All right, today we are going to cover the integumentary system, which is going to include the skin and its derivatives, sweat and oil glands, hair, and nails. I'm going to go through the functions of it, the parts of it, and then I want to talk a little bit about skin cancer, how to detect skin cancer, and burns, the types of burns, and the treatment of burns. And so I'm going to focus a lot more on the skin than anything else, but I will cover sweat and oil glands, hair, and nails just a little bit. But I want to focus on the different layers of skin and what is actually included in those. And so the functions of the skin are going to be mostly protection. Protection from mechanical damage, chemical damage, thermal damage, bacteria, viruses, UV radiation, and then desiccation, which is a word for drying out. So it's going to protect from any outside influences, and then it's also going to keep the body hydrated so it doesn't lose too much water. Temperature regulation is another really important feature of the skin, and that's going to occur through the sweat glands, and I'll talk about the sweat glands in just a little while. The skin is also going to excrete urea, which is a waste that is produced when the liver breaks down proteins. So in your exercise you did yesterday on dialysis, or the day before, sorry, it was the day before, on dialysis, the patient had too much urea. And so one of the treatments for having too much urea or ammonia in the it's circulating in the body is to reduce the intake of protein, because that's ultimately where it comes from. The other basic function of the skin is to synthesize vitamin D and also to aid in immunity. So it's the first line of defense for the immune system also. And then lastly, the skin is going to function in sensory reception, touch, heat, pain, and pressure. So you have nerve endings on your skin that's going to detect any of these things. And if there is any emergency situation, it's going to send a signal to your nervous system, and then your nervous system is going to send a signal back for some sort of action to take place. All right, this is a very complicated picture of the skin structure, and so I'm just going to point out some of the important features of this picture. I want to start with the epidermis. And so the epidermis is going to be the very most outer layer. It consists of keratinized, stratified, squamous epithelium. And you're like, what? What are these words that you're saying? Keratinized just means they're dead. There really are dead cells. So your very outer skin cells are dead, and they're filled with keratin protein. Stratified meaning there's multiple layers. You can remember that from our tissue discussion yesterday. Squamous meaning that they're flat, okay, and they're kind of disc shaped, all right? The dermis is underneath the epidermis, and it's going to consist mostly of fibrous connective tissue. And then the hypodermis, also known as the subcutaneous fascia or fascia, is going to contain adipose tissue underneath the skin. And remember, I said this yesterday, adipose is another word for fat. All right, the hypodermis, which is the deepest layer of the skin, is going to anchor the skin to muscle. It's going to function as a shock absorber. It's going to store fat, and it's going to aid in insulation. So if you think about this, so outermost layer, middle layer, and then deepest layer, you get more functional as you go deeper. Hopefully that makes sense. So the epidermis and the dermis are really there for protection, but the hypodermis is really where most of the function is going to take place. All right, so I'm going to go through each one of those layers briefly here. So the cells of the epidermis, so we're back onto the most outer layer. It consists of cells called keratinocytes. So they're cells that are going to produce keratin, and they are dead scale-like structures, and they're going to be full of this fibrous protein. So if you've ever ladies or guys shopped for shampoo, or you've gone into the hair salon, they'll ask you, like, do you want to get a keratin treatment? And so that's what you're doing for your hair, is that you're filling in like the pores of your hair with this fibrous protein. And so it's supposed to be really good at protection. Your epidermis is also going to consist of cells called the melanocytes. And what those are going to do is they're going to produce melanin, which is a pigment. And so the pigments that can be produced are yellow, brown, and black. And what pigments like melanin are going to do is shield from the, DNA from UV radiation. So the more melanin that is produced in the skin, the more protection against UV radiation, which would make a lot of sense. All right, so that's the epidermis. Now I want to focus on the dermis. So this is our middle layer right here. The dermis is going to consist of really strong, flexible connective tissue. And that's going to include fibers like collagen, and then there's a fiber called elastin. And it's kind of like the semi-fluid matrix where it's kind of cushiony and has fluid in it, but it's got this matrix of collagen and elastin fibers that's going to make it really strong and tough. And when you think of leather hide of animals, so if anyone like makes a purse out of a leather hide, that's the dermis that they're actually making it out of. So you can think of it as being a really tough, kind of soft and flexible, but a really tough layer. It's going to, now we're not dealing with dead cells like we are with the epidermis. We are going to start dealing with nerve fibers, blood vessels, lymph vessels. So lymph is another word for the liquid that contains white blood cells. So you got some immune system function here. It's going to contain hair follicles, oil glands, and sweat glands. All right, and so we have a couple of layers of the dermis. So we're still in that middle layer. We have what's called the papillary layer and the reticular layer. And this is what they're going to look like under the microscope. So this middle pink part is your entire dermis. The outermost part of the dermis is called the papillary layer, and then a little bit inward is called the reticular layer. And so the papillary layer is going to be the upper part of the dermis, so more towards the outside. It's going to have the free nerve endings, and those nerve endings need to be there in case there's a temperature change, some kind of painful stimulus, or some kind of pressure that is dangerous. So that's why those nerves need to be there. There's touch receptors. And then the papillary layer is where ridges are going to form. So this is the layer of the dermis that's responsible for your fingerprints. And so the question comes up, why do we have fingerprints? Many scientists will say there's no point to having fingertips. Other scientists will say, well, that's kind of the leftover, a leftover structure from our ancestors. So when we talk about evolution in some of our other biology classes, this is where we would bring up a structure that really is no longer useful, except if we are discussing like the criminal justice system and taking fingerprints and trying to identify, criminals or looking at suspects in a crime or something like that. But really, fingerprints really don't have any use, but it's believed that they're there because when your fingers get wet and they expand out, it's your fingerprints that form these ridges that are going to help with the gripping ability, which is kind of what tells us our ancestors must have been aquatic to a certain degree. All right, and so this picture right here is just showing you that dermal layer right here. And this is what's called the papillae. So it's the papillary layer that's going to be responsible for forming those ridges and fingerprints. All right, the second layer is called the reticular layer. And so that'll be underneath the papillary layer is the reticular layer. And this one you can kind of see in the picture, it's the deepest skin layer, and it's very, very dense, and it's very fibrous. So this is going to have really dense fibrous connective tissue, so very much protective, and it's going to contain the blood vessels, the sweat and oil glands, and your pressure receptors. So let's talk a little bit about the fibers that you're going to find in this layer. So we're going to have collagen. We've talked a lot about collagen. So collagen's a protein. It gives skin strength. It binds water, so it's very hydrating. And the elastic fibers are going to be there, and it's a protein called elastin, and it's going to be there to stretch and recoil. And so elastin and collagen are the proteins that break down as you age and become fewer and fewer. And so that combined with a person having less subcutaneous fat. And so subcutaneous fat is going to be that little fat layer underneath your skin. And so as you see, like babies and little kids, they're kind of chubby, they have a lot of subcutaneous fat. As a person ages, they're going to get less and less of that, and less of these two fibers right here. And so what that's going to cause is the skin to lose elasticity, and that's going to cause sagging and wrinkles, which is very unfortunate. The other thing that happens with this particular layer, this reticular layer, is during pregnancy when there's extreme skin stretching. And so that can happen during pregnancy, and it can also happen when a person undergoes a period of extreme weight gain, where it happens during such a short period of time that the skin basically doesn't have time to catch up. And so what you're going to have is actual ripping of these elastic fibers. So it's dermal tearing, and it's going to leave scar tissue. And so that is what forms stretch marks. So stretch marks are actual scar tissue, which is also very unfortunate. All right, so some other information about the dermis and the epidermis. Just some random things that I'm throwing in there, some random little tidbits that I'm throwing in there. A blister, so if you get a blister on your foot, a blister is actually a separation of the epidermis and the dermis, and it's separated by fluid, and that fluid is usually going to have like white blood cells, so it's almost like a pussy fluid that separates them. So that's what a blister is, and that's why they say don't pop a blister, because what you're doing is you're exposing the dermal layer, and you're really not supposed to. The blood vessels in the dermis, that middle layer, are going to maintain body temperature. The capillaries are going to swell when you are hot, and so heat will be released. And then your capillaries are going to constrict when you're cold to conserve heat. So just something interesting that I heard, it was a really long time ago, and it might be something stupid to say, but it helps me remember it. So whenever they do like bikini shoots with models in the water, they put them in freezing cold water to make them actually look thinner. Because when you're hot, you swell a little bit. So anyways, when models are doing photo shoots in water, they put them in freezing cold water. It's just what I heard. It might not happen every time, but it's just what I heard. And it makes sense. Bed sores. Bed sores are an issue with someone who is bedridden in the hospital, usually someone who's elderly or very ill. And so what nurses will do is they'll come into the hospital room and they'll have the person rotate. So they'll lay on their left side for a little while, they'll lay on their right side for a little while, and then they'll lay on their back. And patients, if they're usually elderly or ill, they're kind of grumpy anyways. They usually get really, really mad when you come in and try to get them to do that. But the reason is because if there's so much pressure being put on the tailbone, or even on any side, but normally they want to be on their backs, and they're going to fight to be on their backs. But the tailbone area is going to cause so much pressure that the tissue is going to lose oxygen, and it's going to restrict cells, and then skin cells die, and it causes really, really painful, like gross looking ulcers. I had a picture, but I'm not going to show it to you. You can look it up if you're curious, but I just thought it was kind of gross, just because of the area that it's in and the way it looked. But that's what bed sores are, and that's why they rotate patients on their sides. And then the other thing that I thought would be of interest are tattoos. So tattoos are going to involve the depositing of pigment. Normally we think, oh, someone's getting a tattoo, they're just getting their epidermis stained with ink. No, they're going all the way down to the dermis, and this is why tattoos are considered to be very painful. I don't have a tattoo, I've never gotten one. I don't think I'll ever get one because there's just not anything. It's not that I'm like really against it, it's just there's not anything that I can think of that I want permanently inked on my skin that I'm not going to get tired of at some point. There was a point in time where I was like, maybe I should get one. And so I got a pen and I drew what I wanted on my skin. And not like 2 hours later, I was like, no, I'm tired of that. And I washed it off. Anyways. All right, appendages of the skin. So that's how tattoos are done. You have a little assignment where you actually look into a little bit more about how the ink actually stays there and how you can get a tattoo removed. It's actually fascinating. So I hope you enjoy that, that little assignment. It's a quick assignment. Let's talk about the appendages. The appendages are going to include sweat glands, sebaceous glands, and then hair follicles. So I want to talk a little bit about sweat glands. So it almost looks like a little intestine right there. It's pretty cool looking, I think. So the sweat glands are obviously going to release sweat. And when we usually think of sweat, we think it has water and salt, and it cools you off. But the other thing that gets released is vitamin C, and vitamin C is really good and protective against your protective for your skin. Antibodies get released as protection, and then this is another way that waste can get released from your body. So a lot of people don't think about when they sweat, it's actually releasing waste. It's not just for cooling them off. Your sweat glands are the most abundant on your palms, on the soles of your feet, and on your forehead. And I think we all kind of knew they were on our forehead, but then when you think, wow, most of my sweat glands are on my palms and the soles of my feet, that's kind of cool. Um, no pun intended. So it actually is going to be for evaporative cooling. So evaporative cooling is where is what sweating achieves, and what happens is salt and water are going to leave through the sweat gland, and they're going to bring heat with them. And then when when it evaporates off of the skin, the heat gets taken. So it actually cools you off. Isn't the actual sweat on you? It's when the sweat gets evaporated and it takes the heat with it. So something kind of interesting. All right. The sebaceous glands. The sebaceous glands are going to secrete oil, also known as sebum, into the hair follicle. The purpose of that is for keeping the skin really hydrated and waterproofed. It's going to soften and lubricate hair and skin, and all of this sounds so wonderful and great unless you are in that phase of your life where your sebaceous glands are actually going to become inflamed because bacteria love to hang out in that area where all that oil is, which is unfortunate. So that's what causes acne. Acne really is an inflammation and a bacterial infection of your sebaceous glands. So what can be done to treat acne? Reduce oil production. I don't know if you can really reduce the production of oil, but you can clean the oil off of your skin, but then that's going to result in dryness. You can speed up skin cell turnover. So there are creams that you can put on your skin. One of them is called Retin-A. It's called tretinoin cream. And what that does is it increases the cell turnover, meaning that the skin gets sloughed off really quickly, so it prevents plugging of the follicles. You can take oral antibiotics or use topical antibiotics, and then just reducing inflammation in general. Reducing that immune response can help with acne. All right, let's talk about hair. There are two main regions of hair. You have your hair root and you have the hair shaft. What this does is it protects the follicles in the dermis. It consists of dead keratinized cells. So anytime a cell is keratinized, that means it's dead and it's full of that keratin protein. And then you have this really cool muscle right here, the arrector pili. And what this is going to do is it's the muscle that pulls their hair root and pulls hair upright. So when is that going to happen? It's going to happen usually when you get cold or when you get chills for whatever reason. And so there's a little bit of a debate. Well, why do we do this? Some scientists would say that we do it because our ancestors, whenever they got scared or they wanted to appear threatening to a predator potentially, the hair standing up would make them look bigger and would make them look scarier, I guess, and more of a threat, which kind of makes sense. But I think the consensus really is that this happens because our hair fluffs up when we're cold and it's able to trap more heat. And so this is what keeps us warm, really. All right, that's all I have to say about hair. Our nails. Our nails are going to grow from this area right here called the nail matrix. The visible part of the nail is going to be the nail body, the body of the nail. The cuticle, everyone knows where their cuticle is. It's what covers and protects the nail root. The nail is also made of hard keratin, so that protein. So that's why keratin protein is so important. And so what's the purpose of our nails? Well, we have them, they look nice. Some of us get our nails done and we get this acrylic powder put on them and it looks real pretty, but really we use our nails to scratch. But what is believed the reason we actually have them is because our ancestors climbed. They were used to protect our fingers from climbing and from the damage done from climbing. So that's why, most of the reason why we have nails. Okay, that is really all I have to give you on the integumentary system and on the parts. It's actually one of the easiest systems to learn, and it's the reason why I started with it. Not only is because it covers the outside of us, and I want to go kind of from the outside in, but also because it is one of the easiest ones to learn. But I think it is one of the most interesting ones. I do know, or at least I've been told, that when you go to medical school and everyone is deciding what their specialty is, one of the top rated and most sought after specialties is dermatology. So they say the top 5% of your medical school class, those are the ones that are going to get the residency in dermatology and eventually go into dermatology. Whether that's true or not, I don't know. My dad's a physician and he says so, and so does other family members that are physicians. So if you know a physician, you might want to ask them what type of medical student goes into dermatology. And they may tell you different, but at least that's what I heard. That's usually the most sought after specialty. All right, so what are some skin disorders? I'm going to go over two. I want to talk a little bit about skin cancer, and then I want to talk about burns. Skin cancer is going to affect 1 in 5 Americans. So this is obviously something really important to know about. It's caused by UV damage to DNA, and DNA mutations are going to produce faulty proteins, and faulty proteins are going to cause an excess division of skin cells. Excess division. So cancer ultimately is a dysregulation in the cell cycle, a dysregulation in the division of cells. So there's too many cells that are dividing, and that's when you get a tumor, a big mass. There are different types of skin cancer. I want to go over the 3 types. The first type, which is the least serious one, is called basal cell carcinoma. It's the least malignant, but it is the most common. So 80% of skin cancers are going to be basal cell carcinoma. It's going to occur in the layer called the stratum basale. I've heard this pronounced different ways. Stratum basal, stratum basale, stratum basale, whatever. You see the word right there, however the person wants to pronounce it. And it normally is going to occur in the sun-exposed areas of the face. It's going to cause shiny dome-shaped nodules, kind of like you see on this guy right here. They're very slow growing and they rarely metastasize, which means they rarely spread. And they can be removed by surgery in 99% of cases, and they're usually caught, and they usually don't cause a lot of problems, but they do need to be dealt with so that they don't get out of control. And so usually when someone says, I've had skin cancer removed from my face, they're usually talking about a basal cell carcinoma like this that is caused by just going out into the sun too much. Right, the second type of skin cancer is called squamous cell carcinoma. This is going to be a little bit more serious than the last one. It's the second most common. It is going to involve the keratinocytes of the stratum spinosum. Okay, and I'm going to show you a picture in just a second of the stratum basale and the stratum spinosum. They're usually going to present as scaly reddened bumps. They can grow rapidly and can metastasize if not removed. So that's what makes this more serious. And when something undergoes metastasis or metastasizes, that means that it's going to spread throughout the body. It's not just going to stay on the skin. These can be removed by surgery or radiation therapy. Okay, and that's it. You're not writing anything else down. All you wrote down was squamous cell carcinoma for this one. All right, so that first type that I talked about, so remember back this first one, basal cell carcinoma, and then squamous cell carcinoma. Basal cell carcinoma is going to occur here, and then the squamous cell carcinoma is going to be a little further up here. All right, and so you're like, oh, well, isn't it the deeper down, the more serious it is? And that's actually not true. The deeper down you go here, the less likely it's going to have a lot of cell division occurring. And so that's why when you have skin cancer, if it's in this layer right here, there's actually more cell division that happens and it can get out of control a lot quicker. So hopefully that makes sense. The third type of skin cancer and the last type I'm going to talk about is called melanoma. And the melanoma is the most dangerous. It's highly metastatic and it can be really resistant to chemotherapy. So it can spread and it can get pretty aggressive. A third of them are going to come from moles, and so they're going to occur. This is going to be a cancer of the melanocytes, so the cells that produce pigment of the skin. So that's why it has to do with moles. And so the key is early detection. A person can have surgery and immunotherapy, so that's why people get moles removed. And then immunotherapy are going to be injections that are given that help that are going to help ramp up the immune system, because there are cells of the immune system that are responsible for actually killing cancer cells. They're actually called natural killer cells, which is kind of cool. So there's a cell of the immune system called natural killer cells that are going to be responsible for taking care of cancer cells. Right, so melanoma, most dangerous, comes from moles. So early detection is key, right? And so early detection is going to involve this ABCDE rule. And so I want to go over real quick what this means. A means, so right here you have benign, that means not serious. And then on the right you have malignant, that means serious. Got to get this removed. All right. So if you're looking at a mole and it has asymmetry, meaning it's not like a perfect circle, then you need to be concerned. If there's border irregularity, so the second one's going to show you the border. If there's blurry or jagged edges, then you need to be worried. So that's the B. The C is the color. You see how this one on the left, it only has one pigment, one color, but the one on the right has 2 or more shades. That's your C, your color. That's when you need to get concerned. D is the diameter. The bigger it is, the more concerning it is. And when it gets over 6 millimeters, it needs to go ahead and be removed. And then E is for elevation. If it's raised above the surface or if there's an uneven surface, then that is when there is concern. Okay, so this is the ABCDE rule for skin cancer. You have a pretty cool simulation that you're going to do where you have a patient that you're going to biopsy and you're going to look at the cells under the microscope and you're going to determine whether you think it's malignant or not. And so I'm going to leave it at that and then we'll discuss it in the Zoom. I want to talk a little bit about burns. Right, so this is our second type of skin disorder. So tissue damage that's caused by heat, electricity, radiation, or chemicals. And the main threat that burns pose is that they can cause major loss of fluid, dehydration, and electrolyte imbalance. And so dehydration and electrolyte imbalance are going to lead to kidney failure and circulatory shock. So blood volume can go way down, and circulatory shock is going to lead to your cardiovascular system not being able to deliver oxygen appropriately to your organs. And then all kinds of problems are going to happen. So the treatment for burns are going to, the main treatment is going to be replacing fluids via IV until the epidermis and dermis and the hypodermis are able to regenerate. Okay, so some burns are worse than others. I want to go through each type of burn. You have a first degree burn, which is the epidermis only that's damaged, and usually this is going to be your sunburn. Your sunburn is going to be your first degree burn. All right. Second degree burns are going to be an injury to the epidermis and then the upper dermis. What's going to cause second degree burns can be a sunburn. So when you have a sunburn that's resulted in blisters, that's a second degree burn. You need to start using sunscreen. Because remember, UV burns are what's going to damage DNA, and damaged DNA is going to cause faulty proteins, which is going to cause faulty cell division, which is going to lead to cancer. So just use your sunscreen. The other thing that can cause second degree burns are going to be chemical burns. So when you take chemistry, this is why your chemistry teacher is like super strict on how you handle hydrochloric acid and sodium hydroxide, because those can cause pretty bad burns. Sulfuric acid can cause a really bad burn. I actually got a second degree burn from sulfuric acid back when I taught chemistry. Part of the reason why I don't teach chemistry anymore is that I am too much of a risk taker, and I did an experiment that sort of blew up in the classroom, and I was injured on my hand. So yeah, kind of dumb. It was super fun though, and the kids caught it on video. But I'm not going to show that to y'all. This was at my other school. This was not at St. Mary's Hall. A third degree burn is where the entire thickness of the skin, and this is going to go down into the hypodermis. the nerve endings are now going to be affected, and this is where a person's going to need to be hospitalized. And most of the time, chemical and fires are going to cause these third-degree burns. Other things can too, but when you think of someone who's in a house fire that has to be hospitalized, that's a third-degree burn. And then this person's going to need a skin graft. So this picture is kind of blurry and it kind of sucks, but it is a really good picture because it shows you first-degree burn is going to affect the epidermis. Second-degree burn is going to go into the upper dermis. And then third-degree burn is going to be in the lower dermis and the upper hypodermis, potentially. All right, and so a person, here is a picture of first-degree burn. That's just your sunburn. Second-degree burn, this can be chemical or sun that's going to cause blistering. And then third-degree burn, usually this person was probably involved in some sort of house fire or major chemical burn. And so the treatment for a third-degree burn is going to be, of course, replacing fluid loss and then eventually doing a skin graft. And so let me look at how much time I have. Oh, I'm right at 30 minutes. I want to show you this video really quickly. If you get squeamish, and I'm having some issues with technology. If you get squeamish, you're not going to want to watch this, so you can turn away if you need to. But what this is showing is a person that has a burn. I'm going to kind of fast forward here. Here is how they are going to get a skin graft. So they have the burn on the left. They're going to take this thing that almost looks like something you would use, and this is the part that makes me like feel kind of like nauseous. They are going to shave skin, and you're like, wait a second. Why are they damaging skin in order to treat damaged skin? It looks like they're causing the same type of injury, but they're actually not. They are not going as deep on this right side as they are on as this left side. This is actually a lot more of a superficial injury that they're causing. They're going to peel the skin off. Then what are they going to do? Okay. Hopefully she's asleep. Okay, they're going to go to her stomach. They're going to peel some more skin off. That's going to probably cause a little bit of scarring. And then what they're going to do in order to maximize the amount of skin that they took off, they're going to put it through this machine that's going to poke holes in it and kind of stretch it out. That way they can cover a larger surface area using a smaller amount of skin. And then they're going to place it on the burned area, and that they're going to actually graft it onto the burned area. And now cell division and regeneration can occur to kind of fill in those holes that were formed. All right, that is all I have for you for integumentary system. I have some little fun activities that I would have gone over in the Zoom meeting. You have 1, 2, so you have the Snickers activity, the fingerprinting activity, the tattoo activity, and then the medical activity where you're performing a biopsy. These are all 4 short little activities. I think they're kind of fun, so I hope you enjoy them. And I will talk to you guys, and I will go over those things on Zoom later. Talk to you later. Bye.